The gentleman from New York, Mr. Engel, for questions.
Well, thank you, Mr. Chairman. You know, I've been listening to the whining and complaining on the other side of the aisle, and it just really boggles my mind. Madam Secretary, the bottom line is, do we want to provide American citizens with health care, or don't we? I know there hasn't been any enthusiasm for the Affordable Care Act on the other side of the aisle, but you know, let's try to improve it rather than try to destroy it. I noted with a bit of a chuckle the assault on the Massachusetts law. The fact is that the governor of Massachusetts came here and said that the law is working, and I wonder if Governor Romney is going to run on his strong implementation of that law in the Republican primaries when he runs for president. Madam Secretary, what are the most dangerous things in the Republican cuts, as you see it, from your very important point of view of providing health care for Americans and all the other things that are in the Republican plans for funding the government? What do you see as the most draconian of the cuts, and how would it affect the health of the American people?
Congressman, the President feels strongly that education, innovation, building are key blocks for the future. So the investment in early childhood education, which pays huge dividends down the road, the investment in scientific research to keep us at the front of biomedical innovation, the infrastructure for public health delivery with community health centers and funding the training of providers, all of those are jeopardized without having adequate funding in the future, as well as essential services. The Centers for Medicare and Medicaid are looking at increased beneficiaries and a very restricted budget, and our efforts to have new fraud, waste, and abuse efforts, which are really paying off, are very much in jeopardy.
You know, what I see in terms of the Republican plan for funding the government, it's not a matter of the fact that we need to cut to balance our budget. We do need to balance our budget, and I find it odd that we're giving these huge tax breaks to wealthy people, and that blows a hole in the budget, and I find that very interesting. But it's an attempt, as I can see it, to get rid of all the programs Republicans haven't liked for all these years, and to try to tie it in and kind of use the budget problems to do that. You know, we see it on a state level in Wisconsin, we see it all over the country, and we see it on a national level as well. We had Governor Barbour here, and he complained that he didn't like the Affordable Health Care Act, and he would agree to a block grant. Do you think the people of Mississippi would be better off 4 years from now under Governor Barbour's block grant program or under the Affordable Care Act?
Congressman, I don't know a lot of the details about the Mississippi healthcare situation. I do know that they have a population that by poverty level qualifies them for the highest FMAP rate. And one of the challenges of any kind of block grant is, if you would look at the recent economic downturn when millions more Americans qualified for Medicaid because they lost their jobs or their incomes took a drastic downturn, no state would have any help from the federal government in responding to that. It shifts huge burdens, frankly, onto state basis and doesn't have a federal partnership moving forward.
Let me ask you this. There have been a number of criticisms of the pre-existing condition insurance program, and I'd like to just review the facts. First, there was concern over whether there won't be enough money for all the people that will enroll. Then we heard that very few have enrolled, and both criticisms were asserted as failures. How many people have enrolled, and what changes have you made to the program in response? And let me throw out another question tying in with this. Governor Barbour at Tuesday's hearing asserted they were unable to run the program. So were states given the opportunity to run the program? Could they have run it in combination with existing high-risk pools in the states? And the irony, as I see it, is that a high-risk pool was essentially a touted feature in the Republican proposal for health reform, debated right in this very committee last year. So I wonder if you can comment on those things.
Well, there are now approximately 12,000 people across this country who are enrolled in their state or the federal high-risk pool, and the enrollment increased by about 50% over the last couple of months. Many states are finally got their programs set up, are doing aggressive outreach, are informing people. But as you know, there's some pretty strict requirements. You have to be uninsured for 6 months, which is a barrier to a lot of folks. And the insurance, even though it's capped at market rates, is still not inexpensive coverage. This was always designed as a bridge strategy to try and get to 2014 when the market rules will change, and for the first time ever in the history of this country, we will have insurance available without regard to people's pre-existing health conditions. They will be able to participate in a broad-based pool.